Hi everyone, my name is Erica Ferreira and my PowerPoint will be all on organ transplants. We all pretty much know what an organ transplant is, but an organ transplant is a surgical procedure where an organ is removed from one person and given to another. This is usually necessary when an organ is failing. The need of a healthy organ replacement can be detrimental for the person receiving the organ. It can be life or death for the recipient. Depends on what organ is needed. Some may be more necessary than others, or some people can just go longer with their condition. Organs can be obtained from a living human and or an organ donor post-mortem. Now, the utilitarian point of view is to do what is right for the most amount of people. And in my opinion, this is the epitome of organ donation. What use will your organs have with you once you are deceased, when there are so many people that can benefit from a viable, healthy organ? Some people that is what they are waiting for, that is what their life depends on. And in my opinion, if you're just going to take them with you, might as well just save a couple of people if you can. Which organs are transplantable? Living organ donors can donate a part of their liver because it is the only organ that can regenerate itself within a couple of months, and one of their kidneys. They can also donate connective tissue such as blood, skin, and bone marrow. And deceased organ donors can donate kidneys, their heart valves, lungs, their liver, pancreas, intestines, their skin, bone marrow, and tissue such as vessels, and eye tissue such as corneas. Some patients are on multiple transplant lists waiting on either a double or triple organ transplant. That can be kidney, pancreas, heart, lung, etc. Now, to become a transplant recipient, there is no automatic list. If you need an organ, you must receive a referral from your physician, contact a transplant hospital, schedule an appointment for an evaluation to determine if you are a good candidate for a transplant. And if the hospital's transplant team determines that you are a good candidate for the transplant, they will add you to the national waiting list. Different hospitals have different rules and different programs. Each program evaluates organ transplant candidates. Two programs can look at the same data and come to two different conclusions. There are some programs that have an age limit and others that have no age limit. Can you be too old or too sick to receive or donate an organ? When thinking about an organ transplant, some questions may come to mind, such as, would they give an organ donor to a 30-year-old before an 80-year-old? Would they give an organ to a patient that is terminally ill over a patient that could become 100% healthy again once they receive a transplant? Technically, you can't be too old or too sick. There are many programs and each have their own standards. Patients can apply to many programs and get on several lists. Some may accept them and others may not. This just depends on the hospital's program, and some hospitals have designated organs that they pretty much have lists for. Like some hospitals may only specialize in heart transplants, others in heart, kidney, liver, lung. It could vary on the hospital and the program. And the organ will always go to the candidate it best matches. To find a best match, there are many factors that can impact being the best match for an organ. First, you need to get on several lists. After that, the order of the factor becomes unclear. The order may not even matter. These include location, organ transplants have a better have a better chance of success when the time between recipient and the donor organ is short. For example, you are better off if you live in New York State to get an organ that is coming from someone that also lives in New York State, because there is only so much time that the organ is viable after it being harvested from either the living or dead donor. It would be very difficult to get a kidney coming from California all the way to New York within the time period that it needs to be in. Size, for obvious reasons, the size of the organ does matter. A child's organ may not be able to properly support an adult body, and vice versa. Children are also chosen over other candidates for children's organs. There are many tests done at an evaluation. Some include blood typing. There are 4 different blood types that must match between donor and recipient. Cross-matching, taking blood cells from both parties and mixing them to see if the recipient cell attacks the donor. Tissue typing, comparing the tissue and white blood cells between both parties. If these 3 do not match, it is not going to work no matter what. If the blood type does not match and you introduce a foreign blood type or a foreign antigen, the blood will coagulate in the patient and can kill them. Also, human leukocyte antigen testing, which is like what I was saying, measures the number of HLA antibodies in the recipient blood to determine whether they will attack the donor's HLA and reject the organ. Transmissible disease testing as well. Many candidates may test for a match. Once a match run is made, a list will compute with the best match and prioritized by the following. Organ recipients are prioritized by how long they have been on the transplant list, their suspected success rates with the new organ, their age, their prior health history and lifestyle, and severity condition leading to the need of transplant, possibility of death if organ transplant does not happen soon enough, and like previously mentioned, blood typing, size of organ, etc. According to the Hopkins Medicine transplant list, some disqualifications for their heart transplant program are major systemic disease, age inappropriateness, cancer in the last 5 years except localized skin, not melanoma or stage 1 breast or prostate, active smoker. If they have not quit in less than 6 months, they are disqualified to receive an organ. Excuse me. Active substance abuse, as in drugs or alcohol, whatever it may be. HIV, several local or systemic infection, severe neurological deficits, and major psychiatric illness or active substance abuse that cannot be managed sufficiently to allow post-transplant care and safety. Now, some broad liver transplant disqualifications. Severe organ disease due to diabetes, severe obesity, severe inactive liver disease such as hepatitis B, as previously mentioned with the heart, people who are currently on alcohol and drugs, people who have a severe or uncontrollable infection such as HIV, people who are diagnosed with aggressive cancers, with failure of other organs apart from the liver, irreversible brain damage or disease, or an autoimmune disease such as rheumatoid arthritis or multiple sclerosis. This can interfere with the immunosuppressants that they prescribe for anti-rejection. These may vary due to different recipient qualifications within different programs and/or hospital policies. The honor walk for deceased donors. According to Stony Brook Medicine, during the honor walk, hospital staff at all levels, including the care team, administration, and ancillary staff, are invited to silently line the pathway from the ICU intensive care unit to the operating room and pay their respects to the donor and lend support to the family during their journey. If you guys have ever seen this, it is a very emotional thing to watch. Um, it is definitely heartbreaking. It's just a very sensitive and emotional thing to witness. In my opinion, these donor walks are a beautiful way of showing respect to the family. There is a great deal of people that can benefit from a healthy organ donation. Although many people are being saved by these healthy organs, there is still a life lost, and that should always be honored. The fact that somebody can be so selfless and, you know, give back even after their time of death and give the opportunity of life, give the opportunity of having, sight with donating their corneas, or, you know, having giving the ability to breathe on their own with a lung transplant. It's science has come a very long way, and to be a donor, it does take a sense of selflessness, and that is an amazing and beautiful thing to me, at least. Anti-rejection medication. Even after all the cross typing, after all the testing, after everything that you have to go through to make sure that you are getting the organ that is meant for you, there is still a possibility that after everything is done and confirmed, that the organ can still be rejected. Transplant patients take anti-rejection medication to decrease the chance of the organ rejecting. These are also known as immunosuppressants. Since these medications are immunosuppressants, the patient's ability to fight any kind of infection in the future will be compromised, whether it be derived from the transplant or not. So let's say you have an upper respiratory infection. It will take you much, much, much longer than a person that is not on immunosuppressants, because basically it's in the name, but what an immunosuppressant does is it suppresses your immune system. So your body's not able to fight off things such as bacteria or viruses or anything foreign. It will take a lot longer to recover. Success rates have gotten better throughout the years due to improvement in anti-rejection therapy, infection control, surgical techniques, and etc. Organ donors and ethics. Organ donors must sign a consent that they are willing to donate their organs either post-mortem or while they are still alive. On a New York State issued license, there is a heart on the card that says organ donor, indicating that in the case of a fatal tragedy, medical professionals know how to proceed. Kantian's ethical point of view states that the patient's wishes must be respected. With organ donation, family cannot override the decision of the patient once they are deceased. They are simply informed that it is what the patient wanted and that they will be proceeding with the process. I think it can be a shock when something tragic does happen, like an unexpected death in the family, or you're in a situation where you're basically debating whether you should keep your loved one plugged in or unplugged. And if it comes down to the patient or the person passing away, it can be a lot with the initial grief and the initial shock, on also adding that they are going to harvest that person's organs for the greater good, but it could just be a lot to emotionally process. And there are some families that do try to fight it, and it's more of an emotional thing, I would suspect, but if it's what the patient wanted, then that's what should be done. There are some religious groups that do not believe in organ donation, such as Jehovah's Witnesses. They deny blood transfusions and will not consent to any organ donation. This can also be viewed in the Kantian's point of view, since it is the patient's wishes. Now, some questions for you. What are some qualifications and disqualifications that you agree or disagree with? If you were to be put in charge of prioritizing criteria for recipients, how would you prioritize it? Do you think that the system is working well? Do you think that it is unfair? Do you think anything can maybe be changed to better circulate the system, make better decisions? Just give me some input, because I really do think that this is a very interesting topic. And it's good to, one of my favorite things about the class is seeing everybody's point of view and seeing how everybody thinks differently with different things. These are my citations for my slides, and yeah, I hope you guys learned a little something, and if you guys have any questions, feel free to reach out.